And I just want to thank you, Toby, so much for doing this. Would you introduce us to Dr. Charles Hoffe?
Very privileged to have Dr. Hoffe here. We're sitting in his home here in beautiful Lytton, in amongst the mountains today. We were able to track him down, and he's so graciously accepted an offer to my interview request. And so I would like to welcome you, Dr. Hoffe, to the show today.
Thank you.
Welcome, welcome. This is definitely a
Thank
man
you.
of great integrity, very, very bold, and we just really, really appreciate that, which you're going to share with us today.
You're very welcome.
Thank you very much.
You're
Thank
welcome.
you.
We really are grateful, Dr. Hoffe. Thank you very much for being here. We understand now that you have written a letter. One of the things you start out your letter to Dear Dr. Henry, which is Dr. Bonnie Henry, the first dose of the Moderna vaccine has now been administered to some of my patients in the community of Lytton, BC. This began with the First Nations members of our community in mid-January 2021. 900 doses have now been administered. Will you tell me, Dr. Hoffe, what has transpired and what brought you to such concern that you felt you needed to write an open letter to Dr. Bonnie Henry?
Yes, I'll tell you really the story. About a month ago, I expressed when all the news about the blood clots from the AstraZeneca virus and that sort of thing were coming into the news, and there were 12 countries in Europe that had discontinued it, and I just knew that this vaccine rollout was happening without any long-term safety data, and the number of cases of anaphylaxis showed us that the risks of it that were quoted by the pharmaceutical companies in proving their safety were definitely a vast understatement. And we could see that just with anaphylaxis right off the bat. In Lytton, Moderna quoted 1 in 100,000. We've had 2 in Lytton in the first 900 people vaccinated. So, we can see clearly that they fudged their numbers basically to prove the safety of their vaccines. But to get back to my story, I sent an email that I thought was a bit foolish to a group of the people involved in the vaccine rollout here, and these were pharmacists, nurses, doctors, just in our area. I think it went to 18 people, and I just said, with all these side effects appearing, shouldn't we perhaps just pause things for a while? Anyway, within 48 hours, I had a very stern rebuke from my superiors at the Interior Health Authority, who told me that I was guilty of causing vaccine hesitancy, and they were going to be reporting me to the College of Physicians and Surgeons of BC, and that I was forbidden from saying anything negative about the vaccine within our health facility. So I had been given a gag order. So initially I was a bit intimidated because, unfortunately many doctors are, because the colleges hold enormous authority to literally shut down your livelihood or to give enormous fines. So I was a bit intimidated, but as the week went on and I saw more and more people coming into my office with serious neurological problems, following and this was just the first shot of the vaccine, and we know that the second one gives much worse side effects, I became more and more angry about my gag order. And so I was told when I was in my reprimand that if I had any questions about the vaccine, that they needed to be addressed to the medical health officer responsible for the vaccine rollout for our area, and that's who I needed to be speaking to. So I wrote a letter with all my questions and concerns. And of course, my questions have no answers because this is an experiment and we don't know what the answers are. But anyway, I put them all in a letter, and I sent the letter off to this doctor who's the medical health officer, and to date have received no reply, which I suppose wasn't exactly it wasn't surprising.
Unexpected,
so,
yeah.
Yeah, exactly. So after receiving no response from her, I thought, well, then I'm going to write to Dr. Bonnie Henry, who's our provincial health officer. So I thought, because I didn't expect a response from her either, that I would make it an open letter, and that I was so angry about being shut down, basically being gagged and threatened with punishment for speaking out about what I was seeing in my own patients, that I sent it as an open letter, and that's, I imagine, what you have.
Exactly. And is it also correct that that you have been invited to participate in some sort of Zoom call or a safety thing tomorrow afternoon?
Yes, yeah. So to my absolute astonishment, Dr. Bonnie Henry did respond. She had referred the matter to a vaccine safety specialist who asked to have a meeting with me. And so that meeting's going to happen tomorrow afternoon. And so I'm just just trying to prepare myself to be able to speak the truth. And so what I'm telling people about is not some theory. This is what I've seen in my own patients. I've been a doctor to these patients for 28 years. And now 3 of them are disabled by this first vaccine. And it upsets me very much because these people did not know that they were part of an experiment.
Right. So this is very alarming. And this is what we've been seeing, Dr. Hoffe. And I just want to say again that I am so very grateful for you speaking out. And I do not understand why there is being a silencing of doctors who are just telling the truth from their expertise. And so I thank you for your courage in spite of what you are, facing or any repercussions. When you say that you've been a doctor to these patients for a long time, you know them, and also you've seen that one person has actually died, and I believe it was quite a few days after the vaccination, right?
Yes, that's correct. So in that person's case, there's no way of proving what they died from. This was a person who had COPD and was on one medication, which was a Ventolin puffer. So this person just complained to his wife that ever since he had the shot, he was short of breath all the time. And then eventually, 3 weeks after the shot, or in fact, it was 24 days to be precise, he was literally sitting on the side of the bed talking to his wife and just keeled over dead. So I don't know what he died from. Unfortunately, I wasn't on duty that week. An autopsy wasn't done. He was just buried or cremated or whatever happened to him. And so it was just odd. He had no history of heart disease or of strokes or anything else. It was his only. Yeah, so that is an unknown. I just don't know if it was the vaccine.
Right, but I appreciate you raising the alarm because these are things that should be investigated. They are also truths and facts. It's data that we can put forward. So your concern then also is that you're seeing some harms that are coming to other patients. What are the types of things you've seen?
Well, I think perhaps the most tragic of all of them is a very dear 38-year-old lady in our community who had her first shot of the COVID vaccine, and she was one of the people who had an anaphylactic reaction. So within 15 minutes, her tongue and her throat swelled up and she felt like she couldn't breathe properly, and she developed itchy skin, and so she was treated for her anaphylaxis, and once she'd recovered, she went home. The next day found that she was literally so exhausted that for the next 3 weeks, she tells me that she literally slept till 5 o'clock in the evening every day for 3 weeks with a pounding headache. So then she started to improve a little bit after that. And then 1 week after her shot, she developed a Bell's palsy, which is a paralysis of half of your face. So she couldn't close her left eye. Her speech was slurred because it affects your tongue as well. It's hard to eat because you drool out of the side of your mouth. But what was most unusual is that Bell's palsy is not usually painful. But she had pain on the side of her face where this palsy was. So that is something different that I've never, ever heard of a painful Bell's palsy. So she also, at the time that she got the Bell's palsy, just became severely dizzy. And so she's now almost 3 months since her vaccine and still cannot drive. She is so dizzy all the time with incessant headaches. The headaches aren't all the time, they're every day, but the main thing that disables her is the dizziness. And so her Bell's palsy improved to a point that she can actually now close both eyes. But when she blinks, only one eye doesn't blink properly. But so we don't know if her facial paralysis will be permanent or not. But she has been off work since her shot in January, middle of January,
Dr.
with
Hoffe,
no sign of any improvement. Yes.
right. Are you aware of which vaccine specifically that this poor woman took?
Yes. So all of my patients have had the Moderna vaccine.
Moderna. Okay.
Moderna, yes. That's the only one that's been given him.
So this is very difficult. And Dr. Hoffe, isn't this, this has also been reported across the world in other vaccine adverse reaction publications that have said Bell's palsy and things like this are, they are occurring.
Yes, absolutely. And so, I mean, Bell's palsy is disfiguring, but it's not disabling. It's a very unfortunate thing because it often doesn't sometimes it'll fully recover. This young lady doesn't look as though hers is going to recover because for the last 3 weeks, there's been no improvement at all. So hers may well be permanent. Usually you see a steady improvement if it is going to improve.
Right. And so what are, you said there was several patients. What are the symptoms for the other patients?
Well, the others, yes. So another lady who is quite a lot older, she's 81 years old. She told me last week that she does not want to live anymore. She has so much pain since having that vaccine. And so her pain is in her shoulders and her head and her neck. And she just has incessant pain to the point that she just doesn't want to live anymore. Not only does she have this pain, but she has weakness in both arms. So this is not a stroke, because a stroke doesn't give you equal weakness on both sides. I don't know what this is. I don't know if it's something along the lines of multiple sclerosis. It certainly could be. Every one of my patients with neurological deficits is different. Everyone is completely different. So, but they're all neurological problems from the Moderna vaccine. So she told me that not only does she not want to live because of her pain, incessant pain, but her hands are so weak that she can't even open a box of Kleenex tissues. And so she is just miserable and wished that she had never had the shot. Unfortunately, a lot of these vaccines were never tested on elderly and never tested on people with multiple comorbidities. So they sort of chose relatively healthy people to test them on so that they could prove how safe they were.
Wow. Dr. Hoffe, it's so alarming, and thank you for telling us. Sometimes we can read these stories in the publications that come out, but to actually speak to somebody who knows that this is happening. So was there another patient, or could I do want to know?
Yes.
Yes.
Yeah. So the third one who literally also has what looks like it will be a long-term disability, and we can't really. So we're almost 3 months out, so it's maybe too soon to say it's. But when there's just no improvement, it certainly looks like it's going to be. So he's
Right.
a fellow whose only side effect is in the arm where he received the vaccination. So he just has incessant pain in that arm and weakness. So a very weak hand grip on that side. And what was also most peculiar in him, so his is not a pain on both sides of his body. It's just the arm that was vaccinated is just painful all the time. But just a neuromuscular weakness, just a weak hand grip where he certainly wouldn't be able to open a jar or anything like that. But what was odd with him is he had these neurological symptoms of weakness and pain, and also actually paresthesias, which is tingling in his fingers. But about 6 weeks after his vaccination, that arm just suddenly swelled up from about the elbow downwards. So swelling is not usually a neurological sign. That's usually a sign of either a lymphatic problem or a vascular problem. So in all of these people, their side effects are sort of evolving. In other words, there's some process has been started that I cannot identify. These people need to have MRIs and a whole lot of expensive investigations to try and sort out what is going on, but each one is distinctly different. I have other patients who say they can't sleep since having their vaccine 2 months ago, or their feet are sore. It's just a